So we'll talk to the lymph nodes, the thymus, and the spleen as our 3 examples of lymphoid organs. So we'll start by talking about the lymph nodes. I'm sure you guys have all heard this term lymph node before, right? You've probably all had your doctor palpate or feel for your lymph nodes. Lymph nodes are really small, little, kind of like pea-sized lymphoid organs that are spread all throughout the body, but they're highly concentrated in the neck, in the underarm or axilla, and then in the groin and pelvic region. Adults have hundreds of lymph nodes. Okay, so you've got lots and lots of lymph nodes scattered throughout your body. When we look at the lymph node, of course we said that it has this fibrous capsule around the outside, right? That right off the bat is telling you we're looking at an organ. And then we'll see that bundles of these collagen fibers from the capsule will extend in towards the center of the lymph node like this to divide it up into like different sections. We call those trabeculae. That's not good. We call those trabeculae. Okay, so you've got this nice strong fibrous capsule around the outside. It's got a lot of collagen. Every so often, if you move around the node, you'll see the collagen bundles extend in for these little walls that we call trabeculae. And it kind of just separates it into nice little sections, and we'll see that that's important because it kind of controls the flow of lymph as it goes through the node. The lymph node is shaped kind of like a kidney bean, right? So it's got this little like indented area right here, and we call that a hilum. You'll see that word a lot when we do the lungs, when we do the kidneys, anytime there's kind of like a little opening, like a slit-like opening or an indent, we call it a hilum. This little indentation right here that we call the hilum is important because that's where we have a lot of stuff kind of entering and exiting the lymph node. This is where blood vessels and nerves go in and out. So we'll see that we have like arteries that bring blood in, veins that bring blood away, because remember there are living functioning cells that need a blood supply. We'll also see that we have an important lymphatic vessel here. We'll look at them on the next slide, but at the hilum we also have efferent lymphatics. Okay, we have 2 different types of lymph vessels here. These ones are the efferent lymphatics. So, looking at the lymph node, I just said that we have 2 different types of lymphatic vessels or lymphatics that are going to be connecting to the lymph node. So when we look at it, there's my fibrous capsule. I've got these little trabeculae leading in. This is my hilum where I've got blood vessels. And I said over here from the hilum, I have my efferent lymphatic, right? The vessel leading out. And then I have afferent lymphatics that are leading in to the lymph node. And I'll have multiple of them. So there'll be one there, there, there. All of these are afferent lymphatics. So when we're looking at the flow of lymph, what we see is that these afferent lymphatics carry lymph from the periphery of the body into the lymph node. The efferent lymphatics carry the lymph out of the lymph node. So from the lymph node towards venous circulation. Okay, and we see that the efferent exits, so efferent exits, not jump your E's, the lymph node. The afferent goes in. So afferent lymphatics go in through the node. The efferent lymphatics exit node. We'll see that a lot too. Afferent and efferent, we saw the nervous system. We'll see it when we do the kidney. When we look at nephrons, we'll see afferent and efferent glomerular arterioles. We'll see that a lot. And I just remember A comes before E, right? In the alphabet, A comes before E. Afferent, then efferent. And so like if I were looking at the lymph nodes right here in the axilla, I would have vessels that were collecting all of the extra fluid right from my arm, and they were carrying the fluid up towards general circulation. So we would have afferent vessels leading into that node, right? The lymph would go through the node, and then the efferent vessel would carry it out of the node and keep progressing towards the subclavian. Here you can just see nodes. So you can see like the vessels that are going in and out of the node and the node itself. Okay, you kind of see how they're clustered, but this is really what I want you to look at. This shows us a lot. One, you can see that it's kind of Katy bean shaped, right? You can see this indent right here. What do we call this indent? Good. You can see the hilum. This is where we have the artery and vein coming in. We've got nerves that come in there. And then we have our efferent vessel. Does the efferent vessel carry stuff in or out? Out. That carries lymph out of the node. This is a organ, a lymphatic organ. So we do have this fibrous capsule around the outside. And then here you see these trabeculae. This is where like the capsule, all the strong collagen goes in, and it kind of divides this up into nice little sections. Again, this is going to be important because the way the lymph node works is that we've got different types of cells in each of these areas. And we need the lymph to be exposed to each of the different types of cells. So we've got to kind of force it to flow through in this nice direction as it goes from here over to here. Right, or from this area over here. We want it to flow through each of the areas really nicely. So those trabeculae and its kind of organization is really important for that as the lymph flows through all of these little like spaces or cavities in here. All of these are our afferent vessels, right? So they didn't label all of them, but each of these going in are afferent vessels. So the lymph comes in through the afferent. It flows through all these different spaces, which we'll talk about in a moment, as it heads towards the efferent vessel. At that point, it leaves, and almost every antigen should have been removed from the lymph by the time it leaves the vessel, or the node.
Is there only ever one afferent vessel?
What's that?
Is there only one afferent vessel in all nodes?
Yeah.
Okay.
Typically. There's always more afferent than efferent. Typically, you'll just have one. There's probably cases where every once in a while you'll see, but there should just be one. So again, the flow of lymph is really important through the node. And the lymph flows through the node, again, through all of these little sinuses or all these little open spaces. And this is important because each of the different areas has different types of immune system cells present. And when you look at the cells that are present and when you think about like antigen presentation and activation, it'll kind of make sense when we look at the order of all of this. So first it goes through the subcapsular space, right? So the subcapsular space is just right beneath the capsule. And in the subcapsular space, we see macrophages, we see dendritic cells. Macrophages and dendritic cells are both what? APCs, what does that mean? Antigen presenting cells. Remember that if we're going to show these to our T cells, right, to our helper T cells, we have to have an antigen presenting cell present the pathogen, right, present the antigen. So it makes sense that you might want to come across some antigen presenting cells right away so that if there is an antigen present, you can process it and get ready to present it. Then the outer cortex, or the first area of the cortex that we get to, has some B cells. B cells are also antigen presenting cells. When we go through the deep cortex, we get to our T cells. And remember the T cells, this is where we can actually present these antigens to our helper T cells. If they're cytotoxic T cells, then they can directly recognize like abnormal self cells. But any of these antigen presenting cells would present to any of these helper T cells here. And then remember that can co-stimulate beta cells, right? And then from there we go through the deepest area, which is the medulla, and there we see some B cells and plasma cells. What do plasma cells make? Antibodies. And then again, we leave at the hilum via the efferent lymphatics. I will not ask you to memorize this in any way, shape, or form. So you don't have to say like subcapsular space, outer cortex, deep cortex, medulla, like it's just pointless. But what I want you to realize is that the lymph flows through the node intentionally, right? Like we've got the trabeculae and we've got this kind of pattern so that the lymph flows through in a very intentional manner. And as it does that, it comes in contact with macrophages, dendritic cells, B cells, T cells, plasma cells, right? So essentially everything. As it goes through the node, it comes in contact with almost any type of immune system cell that you could want it to come in contact with. That's a really good way to look at that fluid and make sure that it's clean, it's purified. If there's any antigen present, we let the immune system know. Okay, so understand, wow, I'm excited. Understand, don't directly memorize. And this is the same picture again, guys. It's just kind of illustrating that purpose, or that point. That as this lymph, so like if you look right here, as the lymph comes in this vessel, what kind of vessel is this on this side? Good. A before E, right? So afferent brings the lymph in. As you see this, it would go through first this subcapsular space, right? And then we get to go through the outer cortex. Then we get to go through the deep cortex. Then we get to go through the medulla, right? And you're kind of forced to go through all of these different sections, no matter where you enter, right? If I entered over here, if I entered here, no matter where I enter, this nice organization is gonna force me to go through each section where I see all of these different types of immune system cells. And we'll see lots of memory cells in there as well, so that you don't have to go through the whole activation process or the whole antigen presentation process if it's something you recognize. So these lymph nodes act as a filter, right? And we just said this, they essentially like clean and purify the lymph before we put that fluid back in venous circulation. Okay, and that removes debris, pathogens, old cells, and again, over 99% of antigens. So by the time that fluid makes its way back into general circulation, it should be practically antigen-free. It should be very clean. So that's one major function of the lymph nodes, to just clean the fluid, because we're constantly moving it, right? We take it out of the blood into interstitial fluid, from interstitial fluid into the lymph, from the lymph back into circulation. And it just kind of makes its way around. So this is a way to make sure we're constantly kind of filtering and cleaning that fluid to make sure that we get any junk out of it. This is also the site of B cell and T cell activation for peripheral, important, peripheral pathogens. So if you have in your arm right here. Are you laughing? It looks like an elephant, doesn't it? Like, woo! Here, I'll give him another arm so it doesn't look so weird. Okay. If you have worse, it's a gingerbread. Okay, so if you have a pathogen down here, right? You will likely activate your immune system and alert them to the existence of this pathogen as you flow through one of the lymph nodes that's proximal to it, right? Because the interstitial fluid right here is going to get pulled into the lymphatic vessel and it's going to flow back this way. The first lymph node that it goes through is where that antigen is going to come and see these B cells and these T cells, and they're going to get activated, right? Remember, the B cell can process it and show it to the T cell. The T cell activates the B cell, right? And they do that co-stimulation and everything starts going crazy. Right? And that tells the immune system, okay, we've got a problem downstream. this is who it is, and they start replicating to go fight it. So if the pathogen is peripheral, like what I mean by that is in the interstitial fluid, like in the tissues, not in circulation, in the tissues, then we typically will activate the immune system in our lymph nodes. The kind of point behind this, or the reason that we want to clean the lymph and activate the immune system, is that we want to stop pathogens before they get to all of the vital organs in the core, right? And before we get to general circulation. Because imagine what happens when you put a pathogen in the bloodstream. Where'd you just send it? Everywhere, right? If you get sepsis, like if you allow that pathogen to get into your bloodstream, you can send it everywhere. That's very, very, very bad. So the last thing we want is to take this pathogen from something in like soft tissue in your arm and give it to general circulation, right? You're sending it to the heart, you're sending it, if they can get across the blood-brain barrier to the brain, you're sending it everywhere. So we don't want the vital organs to get these pathogens. So we try and clean them out before they get up there to general circulation. Hence why we have clusters of nodes in all these areas, right? The groin area, the axilla, the neck, so that as we take all this fluid up, we make sure it's clean before we bring it up into the little, remember, cisterna chili? And then we make sure we clean in the axillary region, all the stuff coming from the arm, right? That's why you've got those extra clusters in those really kind of strategic places. Lymphadenitis, it's just inflammation of a node. Again, we see that itis. And this is, again, super, super common. Like, everybody has experienced this, everybody will experience this, not a big deal. Whenever a node is fighting, so whenever there's a decent amount of pathogen present in the node can swell. Because, again, you start to have a bunch of cell division. So now instead of this many cells, you've got this many cells. That takes up space, right? So you've got more cells, you've got a bunch of fluid that comes to the area, and the node can swell. When that happens, it's painful. And I'm sure you guys have all had kind of like sore nodes before, and you can feel it. So the doctor, again, will palpate to feel your nodes. And when you can feel this kind of hard, swollen node, you can probably say there's some sort of infection going on in that area. Again, this comes and goes as you fight infections. It's just not a big deal at all. Lymphoma, on the other hand, we mentioned a little bit when we talked about lymphedema. Lymphoma is extremely serious. Oma is normally like tumor, right? So some sort of a cancer. So lymphoma is a cancer of the lymph node. The lymph nodes are one of the most common places that cancer metastasizes. What does metastasize mean? Grows, spreads, right? So it's like a secondary site. So like if you have cancer in your breast first, little cells, cancerous cells will break off from that tumor. And it's very easy for them to enter into lymphatic circulation. Remember when we looked at those lymphatic capillaries? We said that they're lined by these little cells that overlap, right? And these overlapping cells are highly permeable. They're supposed to be. We want all the bacteria and pathogens to be able to enter, right? So they're really permeable. They let pretty big stuff go in. That means they also allow these cancerous cells to go in. So if you have a tumor and the cancerous cell breaks off, gets into the interstitial fluid, it's very likely going to get into the lymph. And it'll travel through the lymphatic vessel. And it'll go until the first node that it comes into. So the cancer will travel along in this first node. It'll find a little nook, like a little place where it can hang out, and then that cancerous cell will start replicating there. Now you have cancer in your lymph node. So lymph nodes are a very, very common place to get cancer. When we look at this, the treatment here is typically to just remove that node and any upstream nodes. Because the thought is, we don't really know if cells have broken off here and traveled up to the next one, right? And so it's better to just remove that next one than it is to wait, think you're fine, and then a year later do the scan and realize that there is cancer there, and now it's in the next one as well. After you remove the nodes, what are you more likely to get?
Lymphedema.
Lymphedema, good. All the scar tissue kind of prevents the flow of the lymph. And it can back up, and then you get all that swelling that occurs. So that's the lymph nodes.